Hi, this video is the before and after hair transplant, but before Sean share his experience to the audience, I'm going to show the audience what Sean looked like before surgery, and after that Sean going to share his experience, what surgery day looked like and all that stuff, and a year later. Front view, right hand side, you see behind the temple as well, right hand side, left hand side, behind the temple, lower hairline, left hand side. Top view, you see he lost half of the head, and look at that. And so that's before, a year later, before. Okay, so now the stage is all yours, Sean. So why don't we start with, how do you found my clinic? How hair loss has affected you?
Hair loss really affected me. I mean, prior to the my surgery day, I was very, very insecure about how I looked, and the hair was like a big thing. I'm 32, so I feel like I should have hair, and I had the hairline of like a 50-year-old, so it didn't align with kind of how I should look or thought I should look. So it really affected my confidence, and I can tell you post operation I feel a whole lot more confident. I don't worry about my hair. I don't worry if a gust of wind is going to come and it's going to ruin me trying to hide my my receding hairline. So I feel very like this was one of the best decisions I made for myself.
It's one of the few investments that grow, right?
Yeah, I mean, honestly, I would have paid double that money, but I'm glad you charged me what you did, and I would do it all over again. And I preach to the world, kind of like if you're thinking about it, and if you're in my situation, it really bothers you, definitely seek Dr. Diep. At least get a consultation. It doesn't hurt.
Yeah. So tell me, how do you find my clinic?
Yeah, so I'm a little on the crazy side. So I really did my research. I wanted to know what types of options there were. I looked. I think that what really drew me into Dr. Diep was he has an array of different YouTubes. So you really get to hear him talk about his work. Also, you get to hear the patients. You get to see kind of the before and after. I felt that was really compelling. So I think the consultation was free, so I thought, oh, what do I have to lose? He's also in the Bay Area where I live, so I thought that was convenient. So
yeah, which is good, because it's sometimes reading review is helpful, but
yeah,
you trust what you see a lot more, right? And then so seeing the before and after is very important to understand what the surgeon capability is.
Absolutely.
And not just that, but how consistent you upload the video and those stuff.
Yeah.
Because you don't want to see one, right? You want to see a lot. And as a matter of fact, I over have 1,200 something video to be exact of the before and after. So that's that. And can you describe and share with the audience what's surgery day look like from the beginning and doing the recovery, and when do you start shedding hair, when the hair come back? So it's a personal journey, and so that'd be very helpful.
Yeah, I think I remember the day before surgery, I was like, I can't believe I'm doing this. This is gonna I don't know.
Nervous.
I was nervous. I was like, I don't know where this is gonna take me. It might work. It might not work. So I was really scared, to be honest. So the next day we started surgery really early at 6 a.m. I want to say.
Yeah.
And the surgery lasted throughout the day. But to tell you the truth, I was put under, and I woke up, and it felt like I was sleeping for an hour, but I was really asleep for I don't know, anywhere from
12
6.
hours.
Yeah.
12 hours surgery.
I was out for a long time, but it really just felt like a dream. So when I woke up, I think I actually ended up taking only a week off. I only took that day off from work. I worked from home for a week, so I was still working.
That's pretty good.
Yeah, so I was still able to work, believe it or not. I personally think people should take time off, but I was like, I'm going to just try to see if I can work. So I ended up working from home the week, with my head, I think it expanded from all the water.
The swelling?
The swelling, yeah. So
when did the swelling disappear? Do you remember?
It was really bad maybe 2 or 3 days in, but then it like went down. You know, Dr. Diep gives you these hats that you wear, so like even though my face was swelling, like if you walk around with that hat, people are like, oh, he's like he just went to the hospital, so they tend to be like, oh, okay, there's nothing wrong with this, like he just, you know, had surgery or whatever. So yeah, I think that was a week. I started you know, wearing hats and stuff after that, and so I wore hats for like 4 months. No one at work noticed, like they're like, no one questioned like, oh, why is Sean wearing hats? So I think like maybe 4 months in, my hair started to look a little more natural, and like I could like
you can see the hairline.
I could see the hairline, and then I cut my hair so that it like was at the same length. So I was like, it was weird because like I was so used to my hairline being here, and now it was here. It like completely changed my face. Like I can't explain it. Like it was like this confidence and like this, I don't know, this new person almost. Like I felt like I don't have to worry about that anymore. So I mean, I don't know, just, and now we're in a year, and like now, you know, I have all this hair. It's great. I can go to a hairstylist, and they can really be. I can just be like, oh, do whatever you want. I don't have to tell them like, oh, you know, I'm insecure about this hairline, so can you please cut it so that it like I have enough hair to cover it. Like I don't have to say that anymore. I just kind of let, you know, them, you know, have their creative vision and you know, make me look good, which is the ultimate goal, right? To look good.
Yeah. So roughly, I mean, in general, it takes a year for it to fully grow.
Yeah.
But probably around 4 to 6 months, you know, you have your hair, and and you have the shape of your hair and all that stuff.
Yeah.
And did anybody notice you had surgery, or?
No. So people would tell me like, oh, you look different, like something looks different. I didn't, like, these are the people I'm not really close to, and like so people did notice something was different, but they couldn't tell what it was. And
must be weight loss or something.
Yeah. Did you do something different? But the constant feedback I would get is like, you look younger, or you look happier or something. So you know, like I'm thinking that the surgery helped to make me look younger, and that in and of itself made me a happier person. Therefore, it kind of permeates through kind of my energy, and you know, it becomes infectious. So yeah, it's just great.
Yeah, well, it's true. I mean, when you have a low set of hairline and a full set of hair, and it frames the face better,
Yeah.
it really, number one, you know how you notice when you look older when you lose hair, right?
Yeah.
But when it frames the face, you do look younger.
Exactly.
But not just look younger, but it really enhances your look, your eyes, your nose, and all the features that
Right.
God created.
Yeah.
So you bring out your handsome look, which you already have. I mean, I didn't change your eyes and nose, right? But we bring it out when you have the hairline right.
Absolutely.
But it takes a whole artistry of creating it, because you don't want to do too high where it draw attention, or you don't want to do too low, and that's important factors.
Yeah.
And there's a whole lot of details involved. And that's why surgery, you know, hair transplant, is important that the surgeon is really involved with the surgery.
Yeah.
Because you know there's some clinic where 100% operated by a technician, and that's, it can't be done that way.
Yeah.
It's, let alone not safe too. So.
Yeah.
but thank you, Sean, for sharing the audience what your experience looked like, and allowing to show the full face, because it's more effective that way. I understand it's helpful when you cover the face. Yeah. And I'm happy with just to, even you asked me to allow me to show only eyebrows and out, but
Yeah.
we showing the full face is more effective, and
Yeah.
and you even your buddies at work he's coming over for me to do surgery, right?
Exactly.
And he didn't. Did he notice, or you told him?
Oh, I told him. Yeah.
Yeah,
So he now, yeah, I told him about the experience I had, and how he should at least go talk to Dr. Diep. So he actually did reach out. And yeah, I think, you know, I actually wasn't going to show my face, but I feel very strongly that like this procedure just helped me so much. And if I could at least, you know, reach at least 1 or 2 people in this world that are thinking about it, and like they just need that extra confirmation, like hopefully I'm that person that allows for that to happen, because it really did change my life.
Well, it's to tell you the truth, and I thank you for that. It's not just helping me, I'll tell you honestly, Sean, but it helps other clients too, or other potential, because you hear a lot of horror story out there.
Yeah.
And you know, you see, even last week I had to fix someone who had plugs, or some people have hairline that it doesn't look natural. You have a big giant forehead. So for me, it's a whole dedication, and for me, it's my passion. You know, and my passion is to create a natural hairline. But when you do it right, it brings it out. You know, and so that's. And I thank you for that, to allow me to show my work. And my work, although it takes a year to grow, but it comes, you know. Okay, so I hope that's helpful for the audience to understand what hair transplant surgery look like. And again, not everybody gonna follow exact same. The result vary from one individual to another. But in general, if you follow my work, it's very consistent. And consistency is the most important thing, right?
Absolutely.
All right, thank you.
Thanks.